Good morning, colleagues. I would like to thank Professor Kostov, Chairman of the jury, and the two secretaries and the organizing committee for being here. And I would also like to thank all of you, ladies and gentlemen, my fellow colleagues, my fellow travelers in science. This morning, today, for example, is the day of Bulgarian Enlighteners, and I think that it is very fitting that we are all here today trying to celebrate and move forward in the fields of science. I want to talk to you today about a field of medicine that is very new. It's called evolutionary medicine. The basic premise of evolutionary medicine is that we use evolution, the theory of evolution, to understand human health and disease. To define what is evolutionary medicine, the International Society of Evolutionary Medicine and Public Health, which is a very long organization name, has an even longer definition, but to keep it simple, evolutionary medicine looks at who we are as a species, why we are a species, and it also uses the theories of natural selection and 14 core principles to understand why we get sick. But at this point, I want to ask, and I'm sure you must all be asking as well, why should we study evolutionary medicine? We study pathology, we study anatomy, some of us this morning, for some of my colleagues, had a pathology colloquium this week, and it was a very difficult exam. Why should we increase our academic load? The answer to that question comes with this quotation: medicine without evolution is a sculpture without physical form. To try to study medicine without evolution is to try to study engineering without physics. Every disease that we have, every injury, every surgery, every infectious disease, every public health crisis has its source and has a framework in evolution. So essentially, because evolution is the unifying theory of biology, everything in biology makes sense only because of evolution. I would like to extend that definition to medicine as well, because after all, we are all biological creatures. I mean, the excellent presentations this morning by my fellow colleagues on infectious disease, the etiology and the naming of those diseases shows that human beings are inextricably linked to certain diseases, some kinds of infections. But why do we develop those infections? That is a question that I hope to answer, and I hope that you will begin to think about this with that perspective. So, why evolutionary medicine? Let me repeat this. You see, evolutionary medicine asks why we get sick in the first place. All of us here are medical students, some of us are doctors, some of us are esteemed professors. When we study medicine, we follow a very simple algorithm. We start with anatomy, we go into function by studying physiology and biochemistry, we go to pathology, and then we go to treatment. You go to internal medicine, and that's just a series of treatments. There is surgery, that is a series of treatments. So throughout this course of medicine, we are asking ourselves how we get sick. But evolutionary medicine asks why we get sick in the first place. Why do we get sick in the ways that we do? For example, why do we get coronary artery disease? Why is it that we get certain types of infections and not others? Why is it that some people will develop certain types of cancer, but others will not? So you see, in order to explain this diversity in disease, the diversity in pathology, the diversity in injury, we need to look at our evolutionary history. So there are 4 core principles. There are actually 14 core principles in evolutionary medicine and 20 other principles that should be studied. But I want to bring your focus on these 4 because these 4 form the central aspect of evolutionary medicine. So there is life history theory, which states that an organism's life events affect its genome and the collective genome of the species. The collective gene pool is affected by everything that organism goes through. Then we go into trade-offs. All biological traits come with advantages and disadvantages. To illustrate this point, I want to talk to you about something called the Colles fracture. So you see, the Colles fracture is a fracture of the distal radius. It happens when somebody falls on this arm and there is a hairline fracture or there is a dislocation at this point. You see, if the radius was just 1 centimeter thicker in diameter, maybe say 2 or 3 centimeters thicker in diameter, you would not get Colles fracture, because at that point the biophysics of the radius ensures that your bone is strong enough to take impacts. But if the humerus was even wider by 1 or 2 centimeters, you would lose the ability to pronate and supinate. So you see, throughout our evolutionary history, we've gained the ability to pronate, supinate, have flexibility, but we've lost strength. The same thing can be said about the spine. So you see, the spine serves two main functions. From an evolutionary perspective, it allows us to stand up straight. I can look at you, I can look at threats all around me. But the spine is extremely unstable because it is made up of multiple moving parts. There are 33 spinal vertebrae. And with each spinal vertebrae, you are increasing the amount of torsion and flexive forces on the spine. It protects the vertebral canal. The vertebral canal protects the spinal cord, the vertebral arteries, all the essential blood supply to the brain. But because it is made up of multiple moving parts, there is an inherent weakness. So for example, if you take a bunch of engineers and you tell them that yes, create a spine, for example, they would not create a spine where each bone is separated by a set of cushioning discs that once there's enough shearing force, you end up getting a disc rupture. The other thing that I want to focus on is that there is always this concept that the human body is a machine. It is come by design. Let me be very clear, at the risk of offending your religious beliefs, the human body is not designed. If somebody brought forward this design today, we would laugh at it. You know, the reason why we study medicine is because the human body is not designed. There are 4,000 genetic diseases. There is enough pathology, disease, infectious disease in the world. Everything that we do comes with a risk. So we would not be studying medicine if the human body was designed in any way. The beauty of the human body comes to the fact that throughout our evolutionary history, we have stumbled through the environment to come to where we are as a species. So that brings me to this concept of mismatch. So you see, there is always an environmental stress that affects the genome, and this response to that stress can be passed on to our children, to the next generation, from parents to offspring. That is why we develop only certain types of diseases. We all inherit immune systems from our parents. We also inherit familial cancer, familiar heart disease. For example, my entire family has heart disease. All the men in my family have developed heart disease, and probably I'm next, who knows. So, all of these three things together come to the next point, defenses. So you see, the body's defenses are evolved because defense proves two conditions again. First, it alerts the body, the organism, that there is some sickness. The second is that it has some kind of protective effect. So for example, let's take a look at fever. When you get a fever, you know that you are sick. There's either an infection or there is some kind of pathology. But if that fever goes uncontrolled, then you create the risk for brain damage. So you see, there is no perfect system here. We are stumbling through an ability to try to fight back or to adapt to the environment. But because the environment is constantly changing, we get an advantage, we have a disadvantage. And all pathologies in the human body are the same. You know, it is the same basic principle. So I want to redefine what a patient is. A patient is a summation of their own life history and their evolutionary life history. So when you look at a patient and you know that he works in construction, for example, or he's a soldier, for example. Let's take a soldier. I like soldiers. This person comes with multiple traumatic brain injuries. He's had 8 concussions in 4 IED attacks, for example. So in his life history shows that this person is at risk for concussive brain trauma. But you see, from an evolutionary perspective, our brain is not protected very well against shocks. So you see, our brains are not designed to take certain levels of shocks. For example, there is a disease that is a complication of traumatic brain injuries. This disease, I forget its name, it's too early in the morning, I haven't had coffee, sorry. But this disease is a sort of like a cerebral apathy. There was a movie on it by Will Smith. So the essential thing is that we develop these unseen diseases because the basic point is that the human body is not designed to do anything. For example, there is no need for the human brain to be hit multiple times across the head. So NFL players, for example, are doing something that is completely unnatural. But a kingfisher, for example, has a protective casing that is connected to its tongue, so it can hit a wooden, like a piece of wood or cement or whatever, 800 times a minute and not develop any brain damage. You take a person's head and you smash it against a wall for 800 times. By the time you've done the 10th strike, you cause irreversible brain damage. So you see where I'm getting at. When you want to look at disease from the perspective of evolutionary medicine, a disease is basically a mismatch between evolutionary stress and an adaptation. So there are multiple factors which provide and cause disease. And in order to understand disease, you need to know why exactly we have those diseases in the first place. You know, for example, why do people get cardiac arrests? Why is it that our heart is designed in a way that makes it susceptible to cardiac arrests? For example, why exactly do we have a brain that is not protected by against sufficient trauma? Because evolutionarily there is no purpose. Human beings could use their hands to make their shelters. Kingfishers could not, so therefore there is an evolutionary divergence. What are the implications of evolutionary medicine? Now, I will admit that there are three fields. The first is public health. We were talking a lot about infectious diseases and infectious disease patterns. I want to talk about something else in public health. So, in 1900, the leading cause of death was tuberculosis, typhus, and cholera. Today, the leading cause of death is cardiovascular disease and cancer. And because cancer is not one disease, it is an amalgamation of multiple diseases, you can see that human beings over the last 100 years have evolved from being able to fight off infections, but now need to develop defenses against a natural propensity towards disease. Second, in medicine itself, to understand why we get certain injuries, for example, the Colles fracture, disc herniations, coronary artery disease. If you have coronary artery disease, the reason you get coronary artery disease is because your left anterior descending artery is not wide enough. If it was just 3 millimeters wider, for example, or 4 millimeters wider, the atherosclerotic plaque that causes coronary artery disease would not make any difference. You would be able to survive much longer. But the laws of biophysics tell us that if you increase the diameter of a vessel, you decrease the pressure. And so in order to combat this lower pressure, our hearts would be like 3 or 4 times its size. So imagine a heart that's trying to fit inside a thoracic cavity that's just this small and it's pushing against the lungs. So you see, there is a function to whatever we have. There's a function to the way the brains are, there's a function to the way we think, there is some kind of evolutionary advantage in the way we work, in the way we are. But all of these things come with a weakness. There is a pro, there is a con, and you just need to balance it out. Finally, I want to talk about the use of evolutionary medicine in surgery, and I will admit that the only reason I can think about evolution in surgery is because of a fascinating lecture day before yesterday by Professor Herkel from Germany, from the Leipzig Institute, who taught us that the oncogenetic morphogenesis of cancer cells helps us to determine better treatment plans. So to summarize what his research was, and you should read his research, it was published in the Lancet. If you look at cancer cells from the perspective of evolution, and you treat them as cells undergoing a certain type of evolution, and you treat them as separate organisms, just the cancer cells, you will be able to find oncogenic sources, and then in the tissue, you can start resecting tissue that has a common embryonic origin. So you don't need to do complete resections. And this and his research has much higher effectiveness rates, survival rates. His research, for example, showed a 93% survival rate in mesothelial resection cancers. So you see, if you use evolution and to understand medicine, you will be able to open your perspective to a wider range of treatment therapies. So, in conclusion, I want to tell you that human evolution forms a framework for understanding human disease and medicine. And at its core, evolutionary medicine asks why we get sick, while medicine is just asking how we get sick. We need both of these questions to serve medicine better. And human evolution should be a basic science that is taught at medical school. It is an evolutionary medicine is just as important as pathology, as public health, as infectious diseases. And without understanding evolution, we cannot understand medicine, not to its fullest potential. Now with that, I'd like to thank you all for your patient attention and your understanding.
Any questions?
No. Yes. Thank you for your presentation. And what do you think about? You said that the diseases are evolutionary. Yes.
Yes.
And it means that we should use evolution as an instrument to treat diseases.
Yes, not just to treat diseases. So this is a very good question. I would like to thank my colleague from Russia here. You see, evolution has made us in a certain way. We've come across, we have adapted as a species with certain weaknesses, right? So what evolution does is to ask why exactly we have the characteristics we do. So for example, pick any disease. Do you have a disease in mind? Let's take syphilis, for example. So why have we developed syphilis? You know, the basic idea, if this was a perfect system, a bacteria that infects the human body and uses it as its host should not kill the host. Because you see, if I'm taking nutrition from something, I should not end up killing it. What is the point? But then, what happens with most of our infectious diseases is that it causes irreversible damage. It can increase mortality if it's not treated, right? So you can understand that when human beings are evolving, along with them pathogenic coevolution takes place. And whenever you look at any patient, although you can't technically say that evolutionary medicine needs to be some kind of replacement for current clinical practice, it is not. Unless evidence is brought forward, you should not change clinical practice. But what it will help you do is you will be able to understand why this person has a disease. You know, for example, imagine a person who is 6'5", right? With increased height, you have an increased risk for spinal problems, right? With decreased height, you have increased problems with cardiovascular disease. You know, if a patient comes to you who is Danish, who is extremely obese, right? You have to ask this patient about their family history. So it turns out that his great-grandmother fought in the resistance during World War II, and during that time, because there was a severe famine, there was not enough food to eat. But evolutionarily what happens is that once you subject people to some kind of starvation, and you remove their descendants from that starvation situation, their descendants will end up developing obesity, because the genetic memory that we've passed on is that there is not enough food to eat. So the body will try to get as much nutrition as possible and try to store it, because the genetic makeup states that there is not enough food, we will not get enough food, we should eat as much as possible. That is the reason why we have obesity as well. I hope that answers your question.
Thank you very much.